Hey guys, what's up? So real quick, 8-month post-op update. I realize I'm a few days late, but it's the weekend, it's a good time to make a video, so I'll just go ahead. So not much has changed in the past month. I think after maybe like the 5-month point, there's not really drastic changes. I'll go ahead and do a close-up. So I just got out of the shower. I do have sunscreen on, so any shine will be because of that. Scars are pretty thin, as you can see. Still have this little irritated area, but that seems to clear up when I have the strips off for a decent amount of time. This part is a little bit stretched. That's just, I don't know how it's been, not a real change. This side is my favorite scar. It starts off a little thick and then just tapers off to almost nothing. This part is almost invisible now in some lights, which is really nice. I do think they've faded a lot, probably since, I don't know, in the past like 3 months. I really think they've faded a lot. I visited my parents back in June, and my mom said she saw a really big difference from March to June. So that was good to hear because, you know, I see them every day. It's not super clear as to their progression unless I look back at pictures. So the grafts are looking really good. Not much pigment has returned since last month. I'm still hopeful that that's going to happen over time, so I'm just kind of being patient. I know tattooing is an option to get more color, but I don't have any tattoos, and even though it's cosmetic tattooing, I think is what it's called, it's not really something that interests me, so if the pigment doesn't come back, I'm fine with it. As far as the scars themselves, yeah, like I said, everything's really thin, flat, very happy. The one thing I did want to touch upon in this video was just kind of the body's healing of scars and how much is in your control, how much is your body, and how much is a surgeon that you go to. So 3 things. So things in your control, like I've talked about, are minimizing like perpendicular tension to the scar. So because the scars run like horizontally, any vertical tension such as reaching up or pushing down, like a dip, something like that, is gonna cause tension to the scar and cause it to potentially widen, especially during the first year, and I've heard up to 1.5 year time frame. So you just want to be cautious of that. Wearing silicone strips or like medical tape can help alleviate a little bit of that tension. I don't think it's enough to make a huge impact, but again, the main reason that I wear the strips are for the sun protection, not really tension alleviation. So that's kind of what's in your control as far as stretching the scars. The next one, I don't remember the order I did this in. The next one being just how your body heals. So when your body goes through the trauma of surgery, it'll produce collagen. So that basically is what the scar is made out of. And doing things like massage are going to break up that collagen and help you have the more flat scar, and it'll be less bumpy. And that's a really good way to just keep the aesthetic of the scar. But as far as stretching, like if you're doing what you can and your scars stretch, it's probably just how the body heals. It's not necessarily something that you caused. And then the other big thing is the surgeon that you go to and their method of closing the skin when they, you know, take the 2 pieces and bring them together. From Garramone's results, I have seen a number of people with stretch scars. I don't know how much of that is due to the closure method he uses versus how well people take care of their scars. I have seen, I think it's Peter Raphael in Texas. He almost very consistently has super thin scars on the results. And I think that probably is due to his closure method, because I see people doing pull-ups like 2 or 3 months post-op and still have crazy thin scars. So that's something to keep in mind when picking a surgeon, is kind of their results. I'm not knocking Garramone in any way. I still think He's obviously the best in my opinion, that's why I went to him. But just don't be too hard on yourself. Like if your scars stretch and you're doing everything you can do, it's probably just your body healing the way it should, or it's how your surgeon closed up your scars or closed up the skin to form the scars. And just try to control what you can and don't fret the stuff you don't. You know, keep your scars out of the sun to keep them less red, and yeah, that's pretty much all you can do. So don't stress it. I had one day a couple months ago, I have like self-diagnosed OCD, so I get kind of, I don't know, episodes of just really obsessing over something and I can't really get past it. So there was one time, like I said, a couple months ago, where this part of the scar, which had bothered me for a little bit, just kind of how it had stretched and then it goes back to closed. I don't know, it was really bothering me and I couldn't get past it, and it's just something that you have to realize that, hey, I really think I've done everything in my power to prevent tension to the scar, and I've been very mindful about the type of workouts that I do. And yeah, at the end of the day, like, your body's gonna heal how it's gonna heal. So try not to stress, do what you can, and yeah, just take care of yourself. Like, again, 1 year isn't a real big investment in the grand scheme of your life. So that's all I have to say. If you have any questions, comments, topic suggestions, whatever, let me know, and I'll see you next month. Thanks.